Excuse me. I thank the gentleman for yielding, and I appreciate the opportunity to be down here on the House floor today to discuss, Mr. Speaker, this extremely important issue of health care. And one of the reasons that it is important, and it is so important, is it affects every single American citizen in a personal way. When I first came here 5 years ago, and as Dr. Gingrich said, I spent 31 years practicing my trade and practicing medicine and teaching in medical school in Johnson City, Tennessee. And I know that the thing I saw as the biggest issue and problem in health care, and Dr. Gingrich did also, was the cost of care. I saw the cost going up, and I saw more and more people that didn't have access to affordable health insurance coverage. And I say this as a joke, but it is true. I have never seen a Republican or Democrat heart attack in my life. I've never seen a Republican or Democrat, never operated on a Republican or Democrat cancer in my life, and I've operated on many of them. These are people issues, and why in the world we passed a partisan health care bill makes no sense to me whatsoever, Mr. Speaker. I have never understood that, now going on 5 years later. We should have sat down in a bipartisan way and talked about, as Dr. Gingrich so eloquently explained, taking care of those 15 or 20 million people, whatever the number is. We could do that. Let me give you just some data in my own state. In 2011, we had 2.5% of our children in our state that didn't have health insurance coverage, and and we're not a wealthy state, and about 10% of the population, 1 in 10 Tennesseans, didn't have access to coverage. Not everybody had a Cadillac plan, but they had basic health coverage. We did this massive 2,700-page bill, which I've read. I almost hate to admit that I've read it all, but I have. And we did this with now tens of thousands of pages of rules that add absolutely no value for patients whatsoever. It doesn't pay for anybody's prescription. It doesn't pay for their operation or hospitalization or immunizations and so on. None of those things. So, Mr. Speaker, I see the need, and certainly the need for health care reform. I totally agree with that. And the premise that if we repeal the Affordable Care Act, that we go back to where we were. Not true at all. And what we did, Mr. Speaker, and again, let me say this, and I believe this to the core of what I did for 30-plus years, and I believe it today, is that health care decisions should be made between a patient, that patient's family, and their doctor. It shouldn't be made by an insurance company. It shouldn't be made by a clerk at the insurance company. It shouldn't be made by the federal government. And I think the rollout of the Affordable Care Act, and one of the problems with that is, and it was absolutely predictable what would happen, because when you listed the essential health benefits, Mr. Speaker, if you read the bill and you had ever run a business as I had, you know that you made some changes in your health insurance every year. We did this. If there was maybe a copay or the out-of-pocket or something changed in that bill, new procedure. If you read the bill, it said if those things changed in any significant way, you lost your grandfathered status. And I apologize if Dr. Gingrich's already done this, but I want to read the essential health benefits that are required for you to buy and purchase. 10 categories: ambulatory patient services, emergency services, hospitalization, maternity and newborn services. Let me just point out that one of my friends who's a Sheriff Seals in Sevier County, Tennessee, came to me the other day when I was visiting there and said he had a friend who just lost her insurance because she's 55 years of age, has had a hysterectomy, and her insurance plan, which met all of her needs, does not include maternity coverage. So she lost her health insurance because, as almost 90,000 Tennesseans have done. Mental health and substance abuse disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services, devices, laboratory services, preventive and wellness services, chronic disease management, pediatric services, including oral and dental and vision care. Those are things that you have to have in a plan or you lose your coverage. And remember now that this is only affecting about 18 or 20 million people. Next year, when the employer mandate kicks in, employer reporting requirement kicks in, many people on an ERISA or a job-related, where you get your health insurance through your job, through your work, If you don't hit these benchmarks, guess what? You're going to lose grandfathered status. And that's where these staggering numbers are 50 to 100 million people, because right now, Mr. Speaker, we provide about 160 million people in our country get insurance through their employment and their families. So that's what we're facing. Now, we mentioned what the Affordable Care Act promised it would do, and Dr. Gingrich's pointed this out very well. He's pointed out that it was promises that were made. Universal coverage. We were going to cover everybody. Didn't do that. No new taxes on the middle class. Well, boy, is that ever something that wasn't true. Annual savings of $2,500. We've heard the President say that on numerous occasions. That's not true. No increase in the deficit. We already know that this bill is going to cost some 2 or 3 times what it was purported to cost. And I think the most famous one we've all heard now enough times, if you like your doctor, you can keep it. If you like your health insurance plan, you can keep it. Not true. We were tasked on the Republican Study Committee, Health Committee, to come up with a market-centered approach to health care, which would include no new taxes, no mandates, maintain the doctor-patient relationship. And it's a very short bill of 180 pages. It has been reviewed back during the Bush administration to increase by 9 to 11 million people that would have health insurance, and we think far more than that. And there are 6 titles to this bill. Very simple to understand. One is to overturn the Affordable Care Act. That's number 1. Number 2 is to equalize the tax treatment between an individual and a company. Well, what does that mean? I'll use myself as an example. When I worked for my medical group, my health insurance was deductible. I then retired from that group to run for Congress, and when I then had to go buy health insurance, I had to pay first dollar. I couldn't deduct it. This simply says you get to deduct your health expenses if you're an individual out there, a farmer, a small business person, just exactly like a huge company like Dow Chemical can do. So it treats you the same as an individual. That's a mistake that was made 60 years ago in the tax law we correct. We massively expand health savings accounts. I use a health savings account. Well, what is that? Well, it's a way where you put pre-tax dollars away in your own account, and if you don't spend them on health care, you get to keep them. I'll use myself as an example again. We had a health savings account for 2 years that we started 7 years ago. I still have $6,000 in that account that I can use for preventive services, for buying prescription drugs, for lots of things that my insurance doesn't cover. And if it's above a $5,000 deductible, my insurance is 100% covers all the costs. And guess who would have had that $6,000 if I didn't have it? The insurance company would have had it as a profit. This allows you and your doctor to make those decisions. We expand those to veterans, to seniors. We also do medical liability reform. Dr. Gingrich has a wonderful bill that we do that for. We also allow you to buy across state lines. It's the only insurance you cannot purchase is health insurance across the state line. You can buy life, fire. I personally have never seen an insurance agent. I've always used the web and bought my insurance across state lines. You can do that, and you can form association health plans. Let's say large church groups want to get together. Instead of small churches where there's one pastor or two, you can join with larger churches in groups across maybe an entire region of the country and get thousands of people. That helps take care of pre-existing conditions. We also have a high-risk pool for pre-existing conditions. And lastly, there's no funding for abortion services. So a very simple bill. It's patient-centered, market-oriented, and it will work. And Mr. Speaker, I'd now like to yield back to my friend, Dr. Gingrich.